Hey, Dr. Durrani here on a Friday evening, and just wanted to jump in real quick and make this quick video about all of the flurry of activity coming out of the CDC. This week, of course, was the Vaccine Advisory Committee's meeting, both yesterday and today, and there is a lot of confusion. If you turn on any major news network, if you look at any news article, it's honestly hard to make sense of what exactly was voted on, why it was voted on it. And, as someone who follows this stuff pretty closely, I'm confused. And I think even if we leave it at that, right? Let's say nothing changes, no new guidances are issued, everything is remains as it is. I think this in itself is damaging, right? If there is confusion, it's going to lead to doubt. It's going to lead to people being hesitant about what protocol or what recommendation to follow. And that already is a big, big, big setback to public health. Now, I'll kind of really quickly try to narrow down my understanding of what happened this week. Yesterday, the big vote, the big thing that made the headlines was the MMRV vaccine. So, the MMRV vaccine is a combination vaccine. You can get MMRV or you could get MMR and then the varicella vaccine separately. The reason for giving them as a combination shot is because it's easier, right? One of the biggest things that the anti-vax movement talks about quite frequently is the number of shots, right? And they'll quote some absurd number or whatnot and scare people into saying, hey, my kid was fine, this kid was fine, and then they got 70 or 80 or whatever number they quote each time, number of shots, that then led to something bad happening. So this kind of obviously goes contrary to that, but then you look at the data. So what is the risk, right? There is a minimally increased risk of getting a febrile seizure. And so in kids, if you get a really, really high fever, you can possibly get a seizure. You bring the fever down, you control the fever, you don't get the seizures. And so they looked at this, and this is something that we've known for a long, long time. This is not new data, not new information. The amount of increased risk of getting that febrile seizure is almost negligible. The benefit of making sure that the kids get those vaccines is higher than the small amount of risk of that seizure, which usually is an event that happens and kids resume their healthy lives afterwards. And so that's why it's been offered like this. Now, if parents want this vaccine separately, even before today, they could do that. So this isn't something new once again. Parents could get them separately. Parents could get the combination vaccine. We knew that there is a minimal increased risk of these febrile seizures. Parents are aware of this. Pediatricians give that information to the parents before administering the vaccine. But once again, they try to make it seem like this is some new information or some breakthrough, which it isn't. The small bit of good news, I guess, if you want to take away good news from what happened yesterday and today, is there was a large concern that universal hepatitis B vaccinations would be recommended to be delayed or rolled back. They delayed the vote and discussion on that. Why they did that, I'm not sure, but at least we did not get a rollback of that over the last 2 days. And then finally, the big news out of today was the COVID vaccination. And so essentially, they recommended that the vaccine is not recommended for anyone. Yes, you heard that right, anyone, right? So I'm talking about high risk, low risk. They said that it is a personal decision and that you should make that personal decision and go that route. Now, once again, that leaves it really vague, really confusing. What if I'm sitting here with a few comorbid conditions? Should I get it? Should I not? I don't have the firm guidance from the CDC to get it. And so once again, that confusion alone is bad enough. Once again, the sliver of kind of good news is that they did not vote on requiring a prescription for that. Now, that if they had, that would have been another obstacle and hurdle, and primary care doctors are already overwhelmed and they don't have the time to see the patients that they have. And now imagine a bunch of patients needing vaccine or prescriptions for COVID. That would have been a nightmare on their part, and once again, another obstruction in getting that vaccine. The other big news out of this week was the health insurance plan group, kind of collective that many of the large insurers belong to, said that they would cover all the vaccines through the end of 2026 that were on the schedule and recommended as of September 1st. So none of these changes will impact what they cover or don't cover. But I think the gist of everything that came out of this week was confusion. And I think even if that is the only thing that came out, that alone is a big setback for public health, because when someone like me, who pays close attention to this, many of my colleagues, when we come away confused, I can only imagine how confusing it is for a parent or an elderly person looking at all this. And sometimes the easiest kind of route when you are that confused is, well, I'm just going to sit at home and not get this shot or not get this vaccine, which unfortunately I think is what the goal here is. And that's just going to lead to a lot more people being sick and not great. So Friday evening, not a great week for public health. I'm looking forward to the weekend. Longhorns are playing. Hopefully Arch gets his act together and we can beat Sam Houston State and look better for our charge into the SEC, but we'll see. Y'all have a good weekend.